morning, everyone, and welcome to the second day of the Digital Health Society Summit 2020. My name is Valentina Tageo, and I have the privilege to lead the international projects team at DHSS Alliance. Our job, as some of you know, is developing and contributing to international research and innovation and implementation actions that try to make a real difference in citizens' well-being and quality of life, and contribute, of course, to make the digital transformation of our health and care systems more inclusive and sustainable. Those of you who had the chance to attend yesterday's sessions could enjoy a series of fruitful discussions around the most recent developments in health data use and sharing. We reflected together around the most urgent issues for citizens, industry, and policymakers, and we were delighted to see many of you actively participating in the debates around the complex topics such as trust, acceptance, interoperability, and data governance through our chat and Q&A sessions. So thank you so much for that. We also had the opportunity to listen about the achievements and the future plans from the 3 countries that are representing the current trio of nations holding the present and next presidencies of the Council of the European Union, Germany, Slovenia, and Portugal. Overall, I think we can conclude that our first day ended with a wealth of insights and the shared commitment to go ahead, work very hard together, and keep contributing to the design, development, and scale up of effective and meaningful solutions that might respond to citizens and healthcare provider needs. And today, with all of this in mind, we will continue our journey looking at the digital transformation of the healthcare sector through different lenses, which I hope will add more value to your DHS Summit experience. And I will have the pleasure to guide you through the rich program that we have prepared for you today. Our first session will be a hands-on training for SME and startups operating in the field of digital health. So let me give you a bit of background about this session and the reason why we are proposing it. Digital health is a huge and quickly growing market where, of course, big corporates and well-established leaders from medtech, biotech sectors have a very consolidated role. But on the other hand, all of us know that SMEs are the backbone of our European economy. And especially in the healthcare sector, they often prove to adapt more quickly than multinational companies because of their higher flexibility, their capacity to understand the local context. They can also be better understood by the local players they interact with. So they are actually, in many cases, better positioned to fill effectively the gaps of the market and grasp the opportunities. However, in addition, I wanted also to stress that the ongoing COVID-19 pandemic has even more confirmed this central role of startups and SMEs. Their dedicated effort and their creativity have brought to the market technologies that could help in treating, testing, monitoring, and tackling many other aspects of the COVID-19 outbreak in a record time. However, key innovators need always support to succeed. So where does the need for training sessions such as the one we offer today comes from? A lot of evidence from studies and reports shows that above all factors, and despite of the many and important steps done so far at European and national level, access to funding for innovative SMEs is still one of the key enablers. This statement was one of the outcomes of the stakeholder analysis that we carried out in the frame of the Innovation to Market initiative, better known for some of you as I2M. I2M is an horizontal initiative born in the frame of the European Innovation Partnership of Active Healthy Aging and led by DHSS Alliance and TIC Biomed. The goal of I2M was to develop a plan and put in place a series of concrete actions to help bridge the gap between demand and supply in the digital health market. To this purpose, stakeholder consultations were run to identify the most important action lines that, in the opinions of the adopters and the vendors, should be taken to try to facilitate matchmaking, adoption, and of course, SMEs growth and job creation. As a result, the companies that we engaged in these consultations found out that there are still insufficient competencies inside the small companies when it comes to craft their own unique value proposition or to get better prepared to convince a potential investor, venture capital fund, that their innovation, their innovative solution is really investment ready. For this reason, I2M will offer today this free training session, which will be delivered by one of the best experts in the field, and I will have the pleasure to introduce her in a while, and it will be made possible thanks to the support of the H2020 program. After the training session and the Q&A, we will continue discussing the barriers to investment, procurement, and adoption that digital health market players constantly face. And we will try to identify roadmaps and strategies to overcome them. We will do this with the help of our great panelists in our second session, which I will introduce later on. Next, I will leave you to enjoy a good cup of coffee and exploring our exhibition space or taking the chance to meet one-to-one with other delegates. And last but not least, we have also planned for you one very interesting session about one of the most mentioned topics yesterday, which was, needless to say, artificial intelligence. Now, I don't want to take more time to our trainer, so I will come back in a very short moment with our expert, Francesca Natalia, for a bit of introduction and some practical info regarding your session. Thank you so much.